Hello, Scobie. And Nancy speaking.
Yeah, it's Lisa Connell.
Yes, so I know you're due to be called today.
Running late.
Yes.
Okay, do we know how long or?
I'm not sure how long, but I know you are on the list to be called today.
I was told I was going to get a phone call at 12. It's only just gone 12, but I've rung them already to say.
Panicking. Just be patient. I know it's really difficult. They will get round to ringing as soon as possible.
You had another look at your scan. We really looked closely. Essentially, the plan remains the same in that if there is growth, it's really a real slight progression. Since 2020, we can just see a minimal progression. Essentially, we would say that's quite a stable scan. I think where you have got this slight progression over 4 years and now you've got these symptoms, what we want to do is just to help you chill out and get on top of the symptoms. We're going to bring you to the clinic. It's better for you to see these images so you can see what we're talking about and you can see that the growth we're talking about over a period of 4 years is very, very minimal.
I thought it wasn't going to even grow after radiotherapy.
We're not saying that you need treatment at all. The advice that we said from the original MD team was to rescan in 2 years, but I'll probably book you a scan for a year rather than 2 years. I understand how anxious you've been, and it's awful when you get those text messages on my chart which are not helpful. That's come from a radiologist in a hut somewhere. I don't even know where they are, and they're absolutely correctly doing their job and uploading these reports. When you get discussed with us at King's, there's a consultant skull-based neuroradiologist looking at your scans with your surgeon, your ENT surgeon, the oncologist, and we're all in there and we're all looking together. A professional eye who doesn't know your complete history may report as a change. We would say, no, look, if we go back to 2013 and we do this properly and more systematically, we say that this is stable. They're just going by a report, but we are going by our history and knowing you.
I trust you guys, I really do. But having that report saying the complete opposite of what you're telling me now is making me think I need to get another opinion.
That's why I wanted you to come up and see us, because this is an essentially stable scan with a small component of progression.
I'm perimenopausal. I've been tested and it's positive. Could that be affecting the tumour? I started that when I gave birth to Ruby after my surgery and radio.
There is lots of evidence that some meningiomas have got feeder cells that thrive on pregnancy hormones. So when you get a boost of progesterone or estrogen, then a meningioma can grow. In the menopause, your hormones are reducing, less hormones that would potentially feed the meningioma. If you were to start on HRT, you're shoving those hormones up and the jury's out. You're only putting your hormones to the level of that they should be at. I would say if you've got a completely resected meningioma and your symptoms of menopause are horrible, probably take the HRT. If you've got a growing meningioma that should be resected and your symptoms of the menopause are not that bad, then maybe hold off. A lot of the research about it is a bit rubbish and a bit unclear, and they come to different conclusions. I think it's generally considered safe for meningioma. It's a risk assessment of weighing up your symptoms of the menopause or your symptoms from the meningioma and what size it is.